Welcome back to a chat with Brian Walker. Hey Brian, how are you going today?
I'm good, thanks David. And yourself?
Awesome. As a behaviorist, I'm always loving life. It's a lovely day in paradise. I'm going to say one phrase to you. Trust me, I'm a doctor. Tell me about that.
Well, trust me, I'm a politician. I often say to my patients, do you trust doctors? Don't trust doctors. And they say, what? Because doctors generally and nurses are probably among the most trusted people in society. And that used to be the case. I'm not sure it is now.
Okay.
Shall I tell you why?
Yeah, what's happened?
Well, first of all, we've got legislation which has come in now which requires doctors to say what the government says is truth, not what science says is truth. So when you're given a question, for example, how safe is my vaccine? The doctor is unable to present information that is peer-reviewed, information scientifically validated. They can't show that because they get struck off if it conflicts with the government's point of view. And it's happened to my colleagues. So now they're giving the information about that the government wants you to have. For example, the flu vaccination. Is it going to help me? Well, yes and no. But I must tell you as a patient, the flu vaccination is good.
Okay.
Is it? It's useful for ring fencing if you've got people working in an aged care home, okay? But for you and me, it's only got about 1 or 2% efficacy. Then they say, does it cause influenza? And the government says, no, it doesn't. I have got so many patients who have been fine, they get the flu shot and then they catch a flu-like illness after that. So I beg to differ. Now, they're saying, no, the government says, no, it's fine. Trust me, I'm the government. It's like the government saying, they're knocking your door. I'm from the government. I'm here to help you. Don't trust them.
Well, I have to ask one question because it's always a question I will ask. Who benefits?
That's a wonderful question. It certainly isn't the doctor. It's not the patients either. Look, there's so many things we could talk about. Who benefits? One of my favorite examples is the vaping laws which came in. Okay. Now, everyone I speak to now says vaping is bad for you. And I say, that's what you've been taught, is it not? And the teachers, a teacher last week is teaching students this government package as to how bad vaping is. All right. Let me tell you what's actually happened.
Okay.
This is the truth. The vapes you get from China are toxic. 50, 60 milligrams of nicotine. They've got vitamin E, which actually, if you inhale that, if you eat that, fair enough, some of them. But here in the chest, it causes honeycomb disease. It kills people, destroys lungs. Now, a whole host of other chemicals you absolutely do not want. Those vapes need to be banned. But the vape shops here had 3 chemicals. They had 5 milligrams of nicotine and reducing. And they restricted, if you were under 18, you couldn't buy things. Yes. Okay, so it was regulated, it was safe, it was structured, and they helped people to come off nicotine, or if they wanted to carry on, 95% safer than smoking, which is an advantage. In fact, the paper I tabled in Parliament, 1,400 pages of research from Europe, would show that if we allowed that regulated vaping, it would save 200 West Australian lives every year.
Wow.
But they banned that. And they stopped the shops. And they promised me that it wouldn't have an effect on the cannabis vapes either. And then they automatically allowed those illegal vapes from China to be imported and sold under the table. The Border Force is catching maybe 5% of them. I had a teacher in last week and a parent as well, and other separate ones, saying how dangerous it was that so many children are vaping in the toilets at schools now. They are at high risk. It's been created by a government who knew what they were doing.
Okay.
So now I ask, who benefits?
Yeah, I'd like to know.
Well, but you have to always follow the money. Now, some people are saying, I don't know if it's true, but some people are saying that the tobacco companies saw their profits going down and therefore they put pressure on people to ban the vapes because they're dangerous. Well, they're not. They're the properly organized ones. And so that now people are returning to smoking. Because now, if you want a script for a vape, you've got to come to me for an SASB application, and the pharmacies have got to supply that. But most pharmacists I've spoken to are not going to do that. It's just not worth it for them. Okay, and so they're not going to do that. So now, what are you going to do? Wait 2 weeks to get your script for a nicotine vape? Or are you going to walk into the tobacconist and get a pack of cigarettes?
Yeah.
What's going to happen to the smoking? In New Zealand, where they allow vaping, smoking has gone down regularly. And they've banned smoking from a certain birth date, okay? So that's falling off. They're doing a good job. This country is doing the opposite. Who benefits? Is it the tobacco companies? Or could it be that the tax that people are paying on tobacco is helping to fund government? Someone somewhere is benefiting it, but our health is not.
No. I wonder what that's about.
Money and power?
Possibly. Not that we talk about money and power on this show, but let's change topics. Let's ratchet it up.
Something nice, please.
Yeah, let's ratchet it up a gear. PTSD, post-traumatic stress disorder, and other alternative ways to manage that. What's your thoughts?
The current scientific approach to managing PTSD with psychiatrists and the medications they can offer, in my experience, has been very little of use.
Okay.
I have got patients just now in my clinic with PTSD who are suffering. They're alive, but they're wishing they were dead. And what's worse, their children are wishing they were dead. Their partners are wishing they were dead because of their symptoms and the way that their life is structured. They are now so disruptive, so non-functional, and the love has gone, the support has gone, the jobs have gone, income has gone. Life is actually pretty hellish. Maybe 5% are doing better after 10 years of those who survive, because there's someone killing themselves in the ex-forces every 2 weeks from suicide. So many people are actually ending their lives because of PTSD. What's happening is just not working well. For some, I've got one patient, they're very, very well, but that's the exception. Well done. Now, what we do have is excellent evidence that the psychedelic-assisted therapies can give much better results.
That's right.
Now, your MDMA, that's your ecstasy, your psilocybin, which is the magic mushroom, we know from research, international research, that with one single treatment, you get 50% immediate cure.
Amazing.
Cure. 85% in 6 months we're looking at. And what's the response from government? Well, first of all, thankfully, they've allowed it to be descheduled from S9 to S8. Okay? More research is needed. Now, this is here the yes minister thing, Sir Humphrey Appleby. Okay, oh, ministers are wise, surely we need more research, which is a great way of postponing advancement. We have a lot of research, we know it works. Is it dangerous? Well, actually, it's a lot safer than medications we currently prescribe. We know that. It's been proven time and time again. But they're saying, the psychiatrists, we need more research, we don't know about this. Anything new is difficult for the medical profession.
So why is there such a resistance, do you think?
Well, the medical profession has always been resistant to change. One of my favourite stories, Dr. Semmelweis. Have you heard of him?
No, tell me more.
1890s in Vienna, I think it was. He was a gynecologist in those days when you were not, and still not allowed to advertise, I'm a good doctor. You can't say that, nor should you, I think. So how did you know that was a good doctor you saw? Well, they used to take off their top hat and their frock coat and they put on their white coat and an apron. And then they'd go and lance a boil and get the pus out there. They'd wipe the hands like that. They'd cut someone like that, there's blood there, they'd wipe the hands. So the dirtier that apron was, the more patients had seen that doctor, and the more popular, therefore the better the doctor was. Okay. So they actually took pride in having dirty aprons, to say how good they were, advertise how good this doctor, look at my apron, filthy. Then they'd go to the postpartum ward after delivery, examine a woman without washing their hands, and inoculate them with bacteria, puerperal sepsis. That's the infections that they got after giving birth. The mortality rates for women in hospital was enormous. Semmelweis wondered if Lister's idea about carbolic soap, washing your hands, might be a good idea. Well, he was hounded out of society, ended his days in a lunatic asylum because, of course, he's mad, and he died of sepsis caused by the doctor with unclean hands examining him, okay, and he died of sepsis, of the very thing he said we could prevent by having clean hands. Now, the colleagues then are the same as the colleagues now. They were well-meaning. This has always been the way. This is the safest. We've shown this is normal. This is standard, peer-reviewed, okay? We're going to not change, okay? Now, look, recently, when you discovered Helicobacter, okay, the doctor who discovered that was going to get struck off because he was proposing something different. but being offered the Nobel Prize. Oh, okay, fine. Now we'll accept this. Now we've given him the Nobel Prize. We're naming streets and hospitals after him. Okay, but the profession thought, oh no, he's different. He's thinking outside the box. We can't have that. So we have a system here which is depending on following what your fathers did. It takes 50 years to change a mind. So of course the psychedelic-assisted therapy is, I don't know, it's a dangerous drug. How many people died of magic mushroom last year?
Probably 0.
Yeah, 0. Okay. Now, can you misuse it? Yes, you can. Can it cause problems? Yes, it can. Okay. But we're talking here magnificent cure rates. Did you know, for example, that if you take microdosed psilocybin, it's far more effective for treating depression with almost none of the side effects of the SSRIs or SNRIs.
Oh, excellent.
It's wonderful stuff.
Excellent.
Can we give it legally? No. You can make it yourself. It's growing freely here in the Southwest. Yeah. Okay. You can, but, Dr. Walker, we need more research.
Well, speaking of thinking outside the box, like all people who join this party or volunteer, they're always outside the box thinkers, as we know. Tell me a little bit about thinking outside the box with hemp. How might we do that? First of all, recognize that there's a multi-billion-dollar industry waiting for us. It's the hemp industry. Yeah.
Let's forget the cannabis. Medical or recreational, let's forget that for a moment, okay? The fact that I can use medical marijuana to help people manage the symptoms of PTSD, let's forget that for a moment.
Okay.
Let's look at the hemp industry, building your houses from hemp, getting fabrics which can clothe us, getting pet bedding, getting roadside dust suppression, 20,000 uses for hemp. It's a multi-billion-dollar industry. It's being stymied. Why? We're frightened of THC.
Oh.
Which killed no one last year, no one in the last 20 years. We're frightened of THC, therefore, regulate, we can't. And they make it difficult. There's $23 million you can get from using the whole hemp plant from 1 hectare.
Wow.
And so the agricultural profession are refusing to get permission because we're frightened of THC, which has killed no one, can be misused, but has killed no one. And so the multi-billion dollars, how many hospitals could be built? How many daycare centers could be built? How much support can we give to the unemployed? How much can we add to, say, the unemployment register in the sense of supporting people looking for jobs without making them jump through hoops and suffer and trying to exist on payments which don't provide nearly enough to live an adequate life?
That's right.
So we're saying no to that because we're thinking inside the box.
Yeah, we're saying yes to other things.
We're saying yes to chronic disease, we're saying yes to poverty, we're saying yes to lack of supply of the needs, the basic needs of a population, because we're frightened of something which hasn't killed anyone, but is outside the box. So now, to think outside the box, you've got to have a mind which allows for differences, for research, for something new, something that might be dangerous, even though we proved it's not dangerous, might be. And so we'll stick with something which is dangerous. For example, we're quite happy with the cars that we've got just now. I like my electric car very much, but 3,000 deaths a year. It's a lot of people being killed on the road. Okay, we're allowing people to drive on the road who are impaired, but we're not detecting them because we haven't got a suitable test for impairment. Well, we could use our eyes and ears in the common sense like the police are trained to do, but we choose not to. Okay, there are tests we could do for checking for impairment, like road lane keeping ability or attention span. We can do that, but we're choosing not to. Are we researching much in the way of checking impairment? No, we're not. Why? Because we've got an adequate test here for alcohol and for THC. Right. Okay, the fact that there's no correlation between THC and impairment is no, we're doing that. Alcohol. Did you know that if you drive with a legal amount of alcohol in your system, up to 0.048, you've still got a 300% increase in accident chance?
Wow, I did not know that.
So you're able to legally drive while impaired. Yeah. How about when you're sleep impaired? Okay, you've worked a double shift, you're not getting a proper rest, the child is crying, So you're driving with having had inadequate sleep. Do you know what the equivalent alcohol level is for driving sleep impaired?
No.
0.08.
Wow.
Which is, I don't know how many 100% more, but it's a very serious risk of an accident. But people are allowed to drive because we're not checking for impairment, and there's not enough police on the roads to see the lane keeping difficulties. Or we get the speed cameras, you know, at 70 when the road is clear and straight, no problems. Okay, there we are. We'll put a flash camera there, right? And we'll get some profit from that. Also useful, it goes into a nice a kitty there for helping those who've been injured on the roads. That's a fine idea.
Yes.
But we have these speed traps set up, but we're not investing in road safety by having enough police on the roads. Why? Perhaps because they're chasing after the vapes, which are being allowed because the government has said, yeah, we'll do that instead of actually legalising proper vapes.
And on a final note, if people invest in this party, if people invest in thinking outside the box, becoming a volunteer, voting for you at election time, what are you going to do for them?
The first thing people have to know is, who are we? It's not just about cannabis. Cannabis is a symbol for everywhere that the government has lied to us. What I stand for is wellness, physical, mental, social, financial wellness with justice, social justice. But when people ask me, why am I in this? It's so that we can build a society which is safer for our children and grandchildren. We can make a new world. At the moment, the last 30 years of laws, are we any better off? We're not. So I want a revolution. I want people to say, there's a change out there. You don't have to vote the old ways. Think new.
Absolutely.
Think safety for your children and the grandchildren. Yes. Think a society which is helping you to be the best you can.
That's right.
That's who we are.
Absolutely. Well, thank you for your time today. It's been wonderful. Thank you everyone for your likes, your subscribes, and please join the channel. Please chat with us and be part of this new way of thinking. Think outside the box, become a volunteer, and we'll see you very soon with another exciting topic. Thank you, Brian.
A pleasure. And remember, legalise cannabis, vote 1.
Absolutely. Thank you. Thank you.